All right, everyone. Thank you so much for your patience and for being with us today. We're really excited to have you as part of our new webinar series, Your Best You. We hope that we can answer a lot of your questions today and get to know you a little bit better. I'm going to go ahead and close the poll. Thank you for your submissions. It looks like most of you heard about us via eBlast, which is wonderful. And at the end of this presentation today, we'll tell you how to get in touch with us so that you can receive those eBlasts and other ways that you can be notified about what's going on at Charlotte Plastic Surgery. So our Your Best You webinar is something that we're going to be doing regularly about every month, but we understand that some of you are new to Charlotte Plastic Surgery and perhaps are unfamiliar with our practice, so we wanted you to get to know us just a little bit. We were established in 1951. We're celebrating our 66th year serving the Charlotte community. We're actually the second oldest plastic surgery group in the country and at one time the largest in the United States. We have 5 nationally and internationally acclaimed plastic surgeons from across the world who are continually recognized by local and national publications and media outlets. We are the only plastic surgery group to ever win a Charlotte Magazine Bob Award. We're super proud of that and excited. And our physicians are winners of multiple other awards like Top Doctor and Best Plastic Surgeon, both locally and nationally. We also have an extensive team of experts working behind the scenes, such as registered nurses and surgical techs, licensed estheticians, laser and cool sculpting technicians, registered nurse injectors, and customer service staff trained by the Ritz-Carlton. So if you've never been here before, we invite you to check us out. So today you're going to be hearing about ThermiVa, also known as ThermiVa. It's a treatment that's been getting a lot of attention in the press, in the media, and in the news. And you're going to be hearing from our ThermiVa technician, Allie Hale. Now, Allie is a registered nurse, also a licensed esthetician, and our certified ThermiVa technician. She graduated from the University of South Carolina in 2011 with a degree in nursing. She worked in the hospital system in Columbia for 5 years as an ICU nurse at Providence Hospital, and then transitioned into the field of cosmetic nursing and attended esthetician school in 2015. She's undergone extensive training in laser treatments, injectables, microneedling, and ThermiVa, and she's been with Charlotte Plastic Surgery since early 2016 and is known by her patients for her compassionate care, skillful approach, and outstanding results. And she's really wonderful to work with. So we're going to go ahead and begin our webinar today. I wanted to inform you of a couple of things that you're going to see. Now, there will be a live question and answer portion at the end of the presentation, so don't forget to submit your questions anytime during the talk. We may not have time to get to all of them today, but we will definitely do our best to respond to all of you, and of course we will send you answers after the webinar has concluded. You will be receiving an exclusive offer at the end of the webinar just for attending and being with us today. And we'd like you to let us know how we did by participating in our polls and surveys during the talk. You can also send us your feedback and questions by responding to our follow-up email. All right, everyone. We're going to have Allie go ahead and begin her presentation. And we look forward to answering your questions at the end of the talk.
Hello, everyone. Welcome to Charlotte Plastic Surgery's ThermiVa webinar. And, I just want to kind of start off by saying, talking about the feminine health isn't the most comfortable conversation to have. But many women are affected by feminine changes like dryness, urinary incontinence, loss of sensitivity, and skin laxity. For these women, we have the revolutionary new ThermiVa. So let's begin and start taking control of our feminine health. And I just want you to know that 3 out of 4 women experience some, if not all, of these issues that we're going to talk about. So remember, you are not alone out there. ThermiVa is a unique way of rejuvenating not only the inside female anatomy, but also the outside. It uses radio frequency to deliver heat at a controlled temperature to the inner and outer vulvovaginal region. As we age, the tissue's collagen decreases, the blood supply decreases, and women can experience loosening, sagging, decreased sensation, dryness, and stress incontinence. And stress incontinence is just a term to describe urine leakage when you cough or laugh. Because the nature of these tissues in this area, it tends to respond better than tissues in other areas. So the radio frequency delivered increases blood circulation, improves vaginal moisture, improves sensation, lifts the pubocervical fascia for urinary incontinence, and lifts and tightens the external female anatomy. There is an instant and noticeable change. There is no pain, therefore no anesthesia is needed, and a matter of fact, it can feel quite nice. The technology is so gentle that you can return to work and sex the same day. So childbirth and the natural aging process causes many changes, in which our feminine health experience many changes. So if you've had a child, you understand that it can be very strenuous and the vaginal canal stretches beyond its capacity. And during that time, we can sever nerves. Those things can lead to vaginal laxity, and severing of the nerves can create problems like a leaky bladder. And that can also affect orgasmic function. Then on top of that, we start to, have multiple births, and we've just compounded that issue. Then the effects of menopause also react to the same type of issues, such as stress incontinence, laxity, and also losing moisture. And with that can lead to painful intercourse. And that affects our relationships. And these are all common things that happen to us as we age, and we should not be embarrassed about. So if you can answer yes to any of these questions, then ThermiVa or ThermiVa can be very helpful for you. By the way, I see and treat patients like this every day, and they are very common. Do you occasionally dribble or leak when you sneeze, cough, or laugh or exercise? Have you ever not quite made it to the bathroom on time, or even sometimes just seeing the toilet, the floodgates just open? Do you feel uncomfortable with the way you look in yoga pants? Do you feel loose vaginally since childbirth or menopause? Do you feel dry during intercourse? Do you have trouble reaching orgasm? And this is very prevalent as we age. It takes longer to achieve orgasm, and there are some women who've never had an orgasm. A common statistic is that 80% of women cannot achieve a vaginal orgasm without having some type of clitoral stimulation. And because of this, unfortunately, women feel that something's wrong with them when actually there isn't. It's very normal. If this were a man's problem, they do have that little blue pill, and also it would be fixed, overnight. Am I right, ladies? Have your intimate relationships suffered due to these changes? Are you experiencing a loss of self-confidence, loss of interest in sex, loss of desire? Who would want to do it if it hurts? So has anyone watched the show The Doctors? This is Dr. Berman, a urologist, on the show who talks about her experience with ThermiVa. And it's really nice to have a woman as beautiful as she is and as successful as she is, sharing her issues on camera so everyone understands that they are not alone. She is a urologist who actually does surgeries for stress incontinence, and she says herself that she's too much of a wimp and would rather have the non-invasive procedure. So let's hear what she has to say.
So it's been about 2.5 weeks since the ThermiVa procedure that I had done recently on stage was painless. It was fast. It was easy. It felt like a little bit of a warm wand waving around inside. Now I feel like I've been putting my vagina up for treatment on this show quite a bit, and this is all in an effort to stave off surgery. Despite the fact that I'm a urologic surgeon, I am the biggest wimp, and I just really do not want to undergo a surgical procedure. Stress urinary incontinence is interfering with my quality of life, my ability to enjoy the activities that I like to do, which is horseback riding. I have literally leaked urine as I'm riding around. So this has got to stop, except for one treatment. I did definitely notice improvement from the ThermiVa. I was at a horse show this weekend, and actually, now that I mention it, no leaks. And I would definitely recommend it to other women based on the fact that my urge incontinence is gone, my stress incontinence is improved. I was told by a friendly outsider that my vagina is youthful, and I've also noticed enhanced, sensation and lubrication. So I'm cautiously optimistic, and I'll keep you updated.
So she had the urinary incontinence, and she had a little bit of the vaginal dryness and decreased sensitivity. She said that it helped increase her sensitivity, and she even had several benefits from the ThermiVa procedure, and even the funny comments that she had about the friendly outsider. So you will see the noticeable improvements after the first treatment visually, and that was what she was talking about. So these are our most common ThermiVa patients, or ThermiVa. Not all, but in general, these are the patients who really benefit from the procedure. We talked about the perimenopausal and menopausal women and what they suffer from. We talked about post-pregnancy, and women who are on bioidentical hormone replacement are taking that so that their hormones are working properly. However, they can still suffer from dryness vaginally. And just because they're taking those hormones doesn't mean that it'll proact the vaginal dryness, but it is something that ThermiVa is something that can be done in conjunction beautifully, and it just enhances that. Ladies, we want you to look and feel good. Women on cancer treatment. When you've gone through a course of treatment, that in itself dries everything out, and for them, there just isn't any other solution because estrogen, anything is usually contraindicated for these patients. So to have ThermiVa that is not a hormone and that can help with their vaginal moisture can be life-changing for them. Difficulty reaching orgasm. The women who came into our study that were not able to achieve orgasm were able to achieve orgasm after 3 treatments. Those that could achieve orgasm could achieve it in 50% less time. Also, patients with that have discomfort in yoga pants or riding a bike due to the excess or hanging of the skin. Ladies, I hope these statistics make you realize that you are not alone, and I feel it's important that you are aware. Urinary incontinence affects 1 out of 4 women over the age of 18. Ladies, that is 25% of females at that age group. That is a big, big number, and by the time we are 50, that number is above 50%, and by the time we are 75, it is above 75. To me, this is a chronic progressive disease state that if we do nothing about, we are going to be in diapers. I mean, the diaper market is huge. The diaper market is more than the napkin and tampon market combined. Huge number. The next point is the reason why I am doing this presentation, because it takes women 6 years to actually talk about it. I mean, why is that? We shouldn't be embarrassed about this. And it is all part of the natural aging process, and we do not need to suffer in silence, and we shouldn't. This is our feminine health and wellness, and we should take better care of ourselves. So atrophic vaginitis, which is the thinning of the vaginal lining, and that is usually accompanied by dryness, and that severely impacts a woman's sexual health for the reasons we talked about before. But here are the numbers. Before menopause, more than 1/3 are affected. Through menopause, 50% or more. So this is what you're going to expect of ThermiVa. 3 in-office treatments done 1 month apart, painless, no anesthesia required, it's safe, non-surgical, 40-minute treatment, 20 minutes internal and 20 minutes external. There's no downtime. You can resume normal activity the same day, including sexual relations and going to the gym. And you're going to have that noticeable improvement after the first treatment. Ladies often say it feels like a warm stone massage, and you're going to have long-lasting results, only needing one maintenance treatment per year. This is a picture of the electrode or the wand. You can see that it is smaller than a finger, and that was done on purpose. An OBGYN actually designed the wand that way it would be comfortable for women. It's a single-use application so that the electrode is utilized and then thrown away. There's a wide treatment range where we keep you very comfortable, and we're constantly getting feedback from you. That way it is comfortable like a warm stone massage. And this is one of those procedures that's really great because you don't have to suffer to feel good and feel beautiful. So how does it work? Let me tell you. When radio frequency energy is applied to the tissues, it creates heat. There's an immediate contraction of collagen or tightening effect, and there's long-term collagen remodeling and elasticity. This is important because as we age, sometimes our vaginal canal, the tissues can really stiffen up, especially if we haven't been using them. So by creating more collagen and elastin, it makes more flexible and helps the comfort of our sexual relations. With radio frequency energy, we are improving blood flow and nerves to the area, and we are stimulating nerve connections, which is really important when it comes to urinary incontinence and orgasmic function. So remember, we have about 9,000 nerves around the vagina. It's important that they are all working properly and signaling properly. So this is an animation of how the procedure is done so that we can get a better idea.
You here can see the wand. It is now being applied to the external tissues. After the first treatment, you will see a visible tightening like you see here, and that continues into the third treatment. And now you're going to see an internal view. This way you can really see the ergonomics of how comfortable the wand fits into the vaginal canal. You will experience a tightening after the first and through the third treatment in the vaginal canal as well, and that also helps support the bladder muscles.
So I'm very happy to be working with a device that was voted Best Feminine Rejuvenation. There are many other procedures out there that use laser technology. The laser ablates tissues and tears down the tissues and relies on your own body's immune system to repair the tissue. In that, it does create the collagen and elastin to help with certain things, but unlike the other ones, ThermiVa is the only one that has the electrical current to help with the nerve supply. And plus, there's more downtime with those other procedures. We don't want that. Most people feel that ThermiVa is a more natural way of rejuvenation, and people really like that. In preparing for your procedure, it's very important to be hydrated. I want you to drink lots of water by preparing for it 3 days before, because radio frequency energy works with our water molecules. So it's very important that we are hydrated. And if you, like me, you cannot go a morning without your coffee, I say that for every sip of coffee, match it with 3 sips of water to make sure you are well hydrated. We prefer that the hair be clipped, closed, or cleanly shaven, but just in the treatment area. No cycle during this procedure. Also, no active infections. This is a very convenient where you can drive to your appointment, have the consult and treatment done on the same day. So I just want you to be aware, I'm going to show you some befores and after pictures. I'll give you just a few minutes to ask your children to leave the room and prepare your environment for viewing of these images. If you choose to minimize your screen during the before and after presentation, I'll be sure to let you know when it's over so that you can maximize your webinar screen again. All right, so here we go. So this is just after one treatment, and I want you to remember that. If you look at the elasticity from before on the left and after on the right, you can see how much better her skin quality is even after one treatment. So this is an example of laxity, and anatomically things are just not in the right place. This might be the type of woman that is uncomfortable riding a bike, wearing jeans or yoga pants. But if you look at by the third treatment, everything is tucked back where it anatomically belongs. So the next picture, if you look to the right, you can see the clitoris at the top is exposed. If you look to the left, it's completely covered up. I mean, look at what this procedure has done by tightening and shrinking that tissue. And that's very important for stimulation from a sexual relation standpoint. Not only visually does it look better, but we have now put things back anatomically where they belong so we can receive pleasure in the right way. So you may now maximize your screens. The viewing is over, the gallery is over. So pricing information. The consultation is free. We recommend a series of 3 treatments at $3,000. One treatment is recommended yearly, and that is $1,000. So ladies, I want you to remember that if you were to have separate vaginal surgeries to correct each and every one of those issues, possibly equaling tens of thousands of dollars, while ThermiVa can take care of those procedures simultaneously for less than the cost of a weekend getaway. So here at Charlotte Plastic Surgery, we are excited to help you reclaim your sexual health, restore your well-being, and revive your relationships. We want you to be happy, and as women, you deserve to be happy. Thank you.
So thank you everyone for giving Allie your attention today. As you can see, this can be a pretty life-changing procedure for women, whether it's leakage when you sneeze or exercise or just want to feel better about your most intimate area. We've just had a lot of extremely positive feedback from our patients about this treatment and what it's been able to do. Now, I currently do not see any questions, and that's actually a great thing. I will assume that we have answered your questions during the talk today, but please don't let that stop you from sending us questions after the webinar and throughout the month after our treatment video is done. Again, we will be sending you a follow-up email. Oh, I do see a hand raised. Let me see real quick. Okay, Allie's going to answer a question here for us from one of our guests.
So one of the very common questions is, can this be done with an IUD? And the answer is yes, yes it can. Many women ask, how long after pregnancy can this be done? And we recommend 6 weeks after a normal delivery.
Okay, we've got another question coming in.
So typically, women that have had hysterectomies or a cervix removal, that's typically not a problem. If if you have any other questions, we can always ask our OBGYN to get approval from them if there's any concerns. But after hysterectomy, that's fine. If you've had one in the past, that's okay. So for scheduling, I'm happy to talk with you guys about that. We can do, like I said, a consult and a treatment in the same day if you like, or you can just do a consult and come back later for a treatment. And feel free to give us a call, and you'll make an appointment with myself at whatever is convenient for you.
All right, and we'll just give one more minute for any other questions to come in. And again, you can send us those questions after the fact. We'll be happy to email those answers to you. And again, the consultation is very thorough. Allie spends a lot of time with you just talking about your concerns and being very realistic about what this treatment can achieve for you. And then the treatment itself is very private. We do make you very comfortable. There is a locked private room that is made to be very spa-like and private and relaxing. We give you headphones and an iPad and just try to make the whole experience very, very relaxing and calm, because this is a topic and a treatment that not all women feel really super comfortable talking about. So we'll do whatever we can to answer those questions so you do feel confident and comfortable. All right, we'd like to do one last poll before we finish our session today. This is just because we'd like to know, we would like you to know that you're not alone in your issues. All women experience some form of insecurity about their feminine health as we age and as we have feminine changes such as menopause and childbirth. So I'm going to give you an opportunity now to go ahead and let us know, anonymously of course, which issues bother you the most, whether it's urinary incontinence, bladder leakage during exercise or activities, loss of sensation and sensitivity, if it's the appearance, if it's laxity of tissue, or if it's vaginal dryness and discomfort during intercourse. We'll give you a couple of minutes to go ahead and complete that. We had a patient recently who is actually in her early 30s, and she was at an exercise class doing jumping jacks and had never experienced leakage before, had not had any children, and felt very young and youthful, and had bladder leakage during her class and had to dismiss herself. And it's something that can be extremely embarrassing. But after just a few treatments, she has reported that she no longer has that issue and just feels much more confident with her active lifestyle. Thank you so much for participating in the poll. It's really quite interesting to see where the results are. We've got 50% of you worried about tissue laxity, 33% worried about urinary incontinence, and almost 20% about dryness. So you can really see it's across the board. On your screen right now, you're going to see the exclusive offer that we would like to provide to you for being a part of this webinar today. So for your attendance, we'd like to offer you 20% off of your ThermiVa package. Now, we do like to do those in a package of 3 because that is going to give you the most optimum results. So that gets discounted down from $3,000 to $2,400. And then if you need an individual treatment, which again we do recommend for your maintenance treatments every year, that is 10% off. So that comes down from $1,000 to $900. What you're going to do is you can call us to schedule that appointment. You're just going to want to let them know the code at the bottom of the screen, which is VA Your Best You, to redeem that offer. Of course, we want to make sure that the treatment is medically appropriate, so you will need a consultation with Allie first to make sure this is right for you. And this cannot be combined with any other offer or promotion, and it will expire on August 1st. So you've got some time to kind of weigh your options, come in and meet Allie, and to make sure that this is something you want to move forward with. So this is how you can get in touch with Charlotte Plastic Surgery on the regular. We do have these monthly seminars going on all throughout the year. We also have a monthly newsletter. And the way you sign up for that is by just visiting our website, charlotteplasticsurgery.com. You'll receive promotions and specials. You can join the webinars and learn about different events, our team, and our practice. You can also follow us on Facebook and Instagram. We post the latest products and treatments. You can see product and treatment demonstrations, real patient transformations from our actual clients, hear provider tips from our experts, recommendations on different industry products and treatments, and then just insider information about cosmetic surgery in general. And then lastly, you can call us anytime Monday through Friday from 8 to 5 to schedule a complimentary consultation. We do see patients both at our Uptown and Ballantyne office. Again, thank you for reaching out to us today and for being a part of this webinar. We hope that we have answered all of your questions. And again, if not, just send us a message. This webinar in its entirety will be posted on our website, on our YouTube channel, and on our Facebook page tomorrow. So if you'd like to share it with a friend, you may do so. And if you'd like to rewatch it to get any of that information, it will be emailed out to you. Again, thank you so much, and we look forward to seeing you at another Your Best You webinar in the future.